In today's Health Alert, new obesity treatment guidelines for teens and children. It's the first time in 15 years that the American Academy of Pediatrics has updated these recommendations, which now include medication and surgery. Our chief health editor, Dr. Partha Nandi, joined us now to explain why these changes were made, Doc.
Yeah, one of the reasons that these changes were made is because obesity rates have really tripled since the 1980s, and there are now 14.4 million kids and teens living with obesity. Another reason is that obesity is a chronic and very complex condition, Brian, and the American Academy of Pediatricians want the public to know that childhood obesity is not a lifestyle problem, and it's not a simple problem to fix, but rather obesity is a disease with genetic, social, and environmental factors. So here's what the recommendations have made that's changed. The group used to recommend a watchful waiting approach, meaning let's see if the child or teen outgrows or overcomes obesity on their own as they mature. But waiting only worsens the problem. So now the American Academy of Pediatrics recommends intervening sooner rather than later. The first line approach is behavior therapy and lifestyle treatment, not just for the child, but for the entire family, which is important. This includes not just nutrition support and increased activity, but also looking at mental health, environment, and social inequities. Also, for the very first time, the recommendations allow approved weight loss medications for kids 12 and older, and teens with severe obesity can now discuss and be evaluated for weight loss surgery. So it's a big change.
All right, so what can you tell us about those drugs? And then just overall, how does obesity affect kids?
Important questions. Research has found that hormones made in the gut play a role in how a person's body uses and stores energy. That's huge, and that's where these new drugs come in. They target these hormones and help people to feel full faster. There are 4 approved drugs for adolescents 12 and up. They're orlistat, Saxenda, Qsymia, and Wegovy. Clinical trial results for the drug Wegovy found that this treatment cut body mass index by about 16% when combined with eating healthy habits and exercise. So that's a big change. As for health issues due to obesity, Brian, children carrying excess weight are at higher risk for asthma, bone and joint problems, type 2 diabetes, sleep apnea, heart disease, and depression. And these can affect quality of life and longevity. Now, I'm pleased with these recommendations overall, but I have to say that medications and surgery should not be first-line treatments, but rather only be used when lifestyle changes don't work. But I think we have to address them and make sure the kids know it's important.
All right, Dr. Nandi, grateful as always.
Less Cheetos during the Lions game also helps.
Cheetos, that's a pass, right? That's a quick pass. Doc, thank you. If you have a health question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter.